Hey, Dr. McNamara here, and today I wanted to talk about a common condition that is known as mechanical lower back pain. Now, mechanical lower back pain is a broad definition for any sort of pain that's stemming from the lower back that is due to muscle tissue, ligaments, cartilage, bone, or the joints themselves. And it's termed mechanical because it's typically associated with some sort of movement or posture. So who's most at risk for this pain? It's going to be adults, typically ages 30 to 50, but really it can affect all of us. And it's going to be mostly sedentary workers. So if you're sitting at a desk, if you're a student, you're sitting for long periods of time, a lot of times the core musculature and the supporting structures will get weakened, and then that will be the mechanism for that lower back pain. But it's also true for people that have very active types of jobs, such as construction workers, in which they're performing repetitive movements very, very frequently, and that can also be a major mechanism in generating this type of pain. Other risk factors are going to be if you're an athlete, especially if you're doing high impact sports and things like that. You're going to be thrown off balance. You're going to be at risk for sprains, strains, things like that. So that's another risk factor. And then just one more final risk factor is going to be obesity. So one thing that's really going to be beneficial is just trying to manage your weight. But today I want to give you guys a little bit of tools and things that can help with this type of pain. So we're going to go over 10 exercises that can help with mechanical lower back pain. The first exercise we're going to do is called pelvic tilt. And you can do them by just coming to the ground. And then typically a lot of times when we have a very tight lower back and we have kind of that lower cross type of syndrome, you'll have your lower back kind of come off the ground when we're laying flat. So what we want to do is tilt the pelvis to build some range of motion and activate the core a little bit. Okay, so I'm feeling my core contract, and that's going to be very therapeutic movement for that low back. Another great type of movement is the cat-cow stretch, or cat-camel, some of you may call it. And for this one, we want to move slow, therapeutically, make sure everything feels good. But you want to arch your back and then slowly try to move one vertebra at a time. I'm starting with the sacrum, which is back here, and I'm trying to move it individually so I can get some good segmental movement at each different level. And then I'm going to do the same thing on the way back, trying to lead with that low back. Again, focus on contracting your core as well as the glutes on this one, and that's a great therapeutic movement as well. Okay. And then after we do a little bit of movement, good time to do a little stretching. So here's a great stretch that will help relieve the muscles in the low back, deactivate a little bit, and get you a little bit of relief that way. And this is just child's pose. You're just going to sit back on the heels, lay your arms stretch in front of you. Good for the shoulders and the lats as well. And then you'll sit here from anywhere from 30 seconds up to 2 minutes. 2 minutes if it feels comfortable. The next one we'll do is more of a strengthening exercise, and this is going to be great for the hips, the low back, and the core as well. And these are glute bridges. So to do a glute bridge, what you're going to do is you're going to lay flat on your back, and then you're going to place your feet flat on the ground, and then you're going to contract through your glutes, keep your core nice and tight and braced, and then drive the hips directly up. You should feel some good contraction in those glutes there. And then to make this a little bit more difficult, you can do one leg at a time and do one-legged glute bridges, just like that. So that is a great way to build strength and stability in the area. The next stretch we'll do after doing those glute bridges is just a simple knees to chest stretch. So you can start, if it feels good, with both legs. For this one, I recommend kind of feeling it out a little bit, grabbing one leg, see if it feels good to pull it over the other side of the body, and look for those tight areas and try to get a nice, light, easy stretch. You should be able to take a deep breath in the stretch, have a conversation. You shouldn't be gritting through it like you're performing high-intense exercise. This next exercise is more for the upper abdominal area. This is a partial crunch. So for this one, what we're going to do is get into that same position we were for the glute bridge, and then place your hands behind the head wherever they're comfortable, over the ears. And then what I want you to think while you're doing this one is your sternum, that mid bone in your chest, think it's going directly up in a straight line. I'm going straight up like that and feeling those abs contract. Great way to help strengthen the abdominals. If you can't go as high up as I am, you can go partially until you build that strength or that core musculature. This next exercise is another great one for strength and stability. This is called a bird dog. So for this one, we're going to get on our hands and knees, all fours, and you're going to extend the opposite arm, opposite leg. Things to focus on: nice tight core, and then contracting through the glutes as you extend. So you do opposite arm, opposite leg, extend out, hold for about a second, keeping that core nice and tight the whole time, just like that. So for this next exercise, we're going to need to head over to a wall. And this exercise is really simple. It's like sitting. You're just not going to use a chair. So you're going to use leverage to push up against the wall. And then try to get about a 90-degree angle or so. If you're having knee pain in this position, just go up a little bit higher and see if that relieves it, and if you can do this exercise that way. But this is going to be a great way to help strengthen up the legs, the hips, again, as well as the core. And hold for about as long as you can. A great place to start is anywhere from 10 seconds to 30 seconds, up to a minute, maybe 5 to 10 minutes if you're in really good shape and have very good endurance. But wall sit is an easy, accessible exercise that can help strengthen the legs. So the last couple exercises we're going to do are just some stretches just to help relieve any tension within the hips as well as the low back. First one is going to be hip flexors. So the hip flexors, they actually attach into our lumbar spine, that psoas muscle. So to stretch this, we're going to get in a kneeling position, and then we're stretching the side that's going to get extended. So what I'm going to do is I'm going to extend my right hip, and I'm starting to feel stretch right in the front of my hip there. And then to get a little bit more out of it, I can lean back due to that lumbar attachment, and then I can even rotate the opposite direction as well. And then for this, you're going to want to hold for about 30 seconds, repeat 3 to 5 times or so, and that will really help relieve a lot of that hip flexor strain that we get from sitting a lot with that shortened hip flexor position. The last stretch that we're going to go over is fairly simple. It's just a nice, easy hamstring stretch. One nice way I like to do it is doing one leg at a time, so unilateral, and then bringing the other leg, bringing the foot to the inside of the thigh on the leg we're going to stretch, and then just leaning into that stretch, trying to keep that leg as straight as possible. I'm feeling a nice, good stretch in my hamstrings right here. So those are 10 exercises that will help not only mobilize the spine, but also strengthen it, so you're going to be more durable and have better prevention of low back pain in the future. Last 3 key tips I want to talk about is, one is make sure you're taking this nice and slow and making it easy. We don't want to do anything that's going to make symptoms anything worse. And that brings me to my second tip, which is if anything is hurting, stop doing that exercise or that movement, and it's probably best to see a medical to get a diagnosis, because these movements shouldn't be painful. And then the third and final tip is to maintain some sort of regular stretching routine, because that's going to ensure that we have that mobility, flexibility, and strength long term, so that we do not regress and develop any sort of mechanical low back pain in the future. So thank you guys for watching, and if you guys like this type of information, please like and subscribe for more health and wellness. Thank you.